started.
Alright, so the first thing I'm going to do is I'm going to check in my mark for my provider orders. My provider has ordered 250 milliliters of 0.45 normal saline to be administered over 30 minutes. So 50 milliliters per hour is what I'm going to set my pump to. I'm going to grab my fluids, double check against the MAR. It's going to be my first check. I'm also going to look at the bag, make sure it doesn't have any, make sure the fluid's cleared for saline, make sure there aren't any leaks, check the expiration date, make sure it's not expired. Just looking for any cracks, tears, inconsistencies, anything that might hurt my patient or anything that looks kind of off, which is good. I'm going to gather the rest of my supplies, so I have a saline flush, I have my primary tubing, and I also have some alcohol swabs. I'm going to check one more time before I enter the room. This is my second medication check. I'm just going to double check the dosage, the timing, the provider order, the expiration date, make sure it's for the right patient, which I'll have to double check again when I get in the room. But so far everything looks good. So when I come in the room, I'm going to knock out for hand hygiene. Hi, my name is Ellie. I'm a student nurse from St. Martin's. Can you tell me your name and your date of birth? And I'm going to double check it with their ID band. Perfect. All right, your provider has ordered that I start some IV fluids. This is going to be 0.45 normal saline. And it's going to be running through the IV catheter that the nurse inserted not too long ago. Do you have any allergies to anything like any saline, any adhesives, anything like that? No, I'm going to explain what I'm going to do, which is fairly simple. I'm going to hang the fluid, spike it, and then attach it to your port. I'm going to do one more check at the bedside just to make sure I have the right medication, dosage, the right route, right time, and check one more time that my IV bag is packed, which this looks good. I'm going to perform hand hygiene, don my gloves, I'm going to struggle with my gloves, and then I'm going to raise the workstation, which in this case is just my lovely floating arm, to a working height that's comfortable for me, making sure the patient is comfortable too. I'm going to put it up a little bit. All right. I'm going to open my tubing. I will be attaching it to this pump. Come on. I'm going to struggle to open the tubing first. I'm really going to struggle to open the tubing. There we go. Alright, making sure that this end is sterile and doesn't touch anything else. I'm going to take my fluid out. I'm going to hang it first before I spike it. Remove the cap. Take off the cap. And then spike it, making sure not to touch into anything. So once I get it in, I'm going to let this run down a little bit. Again, making sure that the end that ultimately goes attaching to the patient is not touching anything because it is technically sterile. I'm trying to untangle this mess I made, I'm also going to be checking the tubing so I don't see any obvious defects, so anything that could, any kinks, anything like that could hinder the fluid flow to my patient, which other than this mess looks pretty good. This entire video is just going to be me struggling to get this untangled. But that's okay. There we go. Alright, so now that my tubing is entangled, I'm going to fill the drip chamber a little over halfway. Unclamp it. Should be unclamped. And let the fluid run through the tubing, getting all the air bubbles out. So that looks pretty good. I'm going to clamp it. I've lifted my cap back on, but I dropped it, so I can't do that. So I'm just going to make sure, because this end is sterile, I'm going to hold it and make sure it doesn't touch anything else. Then when I open my saline, I'm going to put the cap from there on it. And then hang it, just making sure this doesn't touch the ground or anything. Alright. Next step, I'm going to scrub the hub for at least 15 seconds. And I'm going to make sure I double check the site for any signs of infiltration before I start. So 15 seconds. Making sure it's nice and clean. Giving it a little bit of time to dry out. I'm going to make sure to get all the air out of my saline. There we go. And then I'm going to connect it and flush per hospital policy. I know on the checklist it says for about 1 minute. Come on. Before we start, can you please verify your name? Except it's not flushing. Is the plunger stuck or something? So you provider order for the IVP medication for sensory accents, on-site bacteria. Oh, that's why. Because it was clamped. Alright, so I'm going to flush, making sure to monitor the site for any infiltration, any leakages while I'm administering this. Do you have any allergies? And again, it should be over 1 minute or whatever hospital policy is. Are you feeling any pain right now? Alright. And do you agree to this procedure? And after you aspirate for blood, you're going to inject at least 3 milliliters, or again, depending on what your hospital policy is. Then I'm going to scrub the hub one more time. As long as there's no infiltration when I was injecting that saline, everything should be good. I'm going to monitor my patient for any signs of an allergic reaction while I'm doing this. I'm going to scrub the hub for 15 seconds again. I'm going gonna hold it, making sure it doesn't touch the patient again because then it's unclean. I'm gonna grab my tubing. Which still has the scalp cap on it. I'm gonna take off the cap. Making sure the tip doesn't touch anything because it is sterile. I'm going to attach it to my patient. I'm going to drop it on the floor, is what I'm going to do. So reset the moment. I would not let it slip out of my hands. And I would successfully connect it to the port. Take two. There we go. So now that it is successfully connected, I'm going to make sure, you can double check, there are no bubbles. I'm going to insert my see if I can get it in on the first try. Alright. Alright, so if I was able to get this in all the way, I would make sure that it's all unclamped so the fluid can properly get to my patient. I would set the rate of the pump, which would be 500 milliliters per hour, because the doctor has ordered 250 milliliters over 30 minutes. And just one last double check. After the pump has started, the fluid is actually running. I'm going to clean up my mess. Thing else I need. Do one last check. Hand hygiene. Alright, how are you feeling? Feeling pretty good? Alright, well, if you start feeling any pain at the site or notice any redness or swelling, use your call light and let me know. I'm gonna lower the client's bed again, make sure their call light is within reach, and I will come back in about an hour or in about half an hour to see how you're doing, okay? Alright. And that should be it.
Okay.